Good morning, everyone.
Good morning.
Good morning, everyone.
Good morning.
All righty, great. We have a pulse in the room, and that's important. We have a lot of doctors here. My name is Sharon Gordon, and I'm the moderator for the JAHJAH Foundation's 15th Annual Emergency and Critical Care Point of Care Ultrasound Focus Workshop. And of course, we're pleased to be partnering with the Ministry of Health and launching Start Right, a maternity and newborn care initiative. It's being supported by the American Friends of Jamaica, and I think that deserves a round of applause, like right here. You know, we have some esteemed persons in our midst this morning, and I'd like to start off by establishing protocol and just acknowledging them. And of course, we start off with the Dr. the Honorable Christopher Tufton, Minister of Health and Wellness. The Honorable, feel free to applause, we love applause early in the morning. The Honorable Juliet Cuthbert Flynn, the Minister of State in the Ministry of Health and Wellness and Member of Parliament. Dr. Trevor Dixon, visionary, and he's our visionary founder and CEO of the JAHJAH Foundation. Dr. Melody Enos, Director of Family Health Services, Ministry of Health and Wellness. Ms. Wendy Hart, President of the American Friends of Jamaica. Dr. Garfield Clooney, Associate Professor, and Vice Chair of Diversity, Equity, and Inclusion in the Department of Obstetrics and Gynecology, Division of Maternal Fetal Medicine at NYU Langone Health in New York, and he is the 123rd President of the National Medical Association. And I got a throw in there, and a yardie. And another yardie is here, Dr. Marie Small. And she's from maternal fetal medicine, and she's a specialist in that area. Miss Adwana, clap her up. Miss Adwana Clayton, Director of Education and Training, Butterfly Network, Inc. Thank you for being here. And Claudette Powell, Chair of the Jamaica Diaspora Northeast Sector and Public Relations Officer for the Jamaica Nurses Group of New York. Where's Claudette? We also have with us heads of regional health authorities, senior health officials, and other representatives from the Ministry of Health and Wellness. We have our volunteers from the JAHJAH Foundation, local physicians who are attending our workshop, members of the press, and of course you, ladies and gentlemen. I say welcome and thank you for being here today, day one of our 2-day intensive ultrasound workshop. Now, I'm sure many of you are aware that there's like a little buzz of activity going on, indicating that there is something very special and important happening afoot. So before we start our workshop, we will do the official launch of Start Right. Yes, clap it up. This is a maternity and newborn care initiative that is near and dear to someone that is sitting right here on this podium, but we're going to get to her in a minute. This particular initiative is being undertaken by the Ministry of Health with support from the American Friends of Jamaica and Jamaicans abroad, helping Jamaicans at home, the JAHJAH Foundation. And today culminates months, and I mean months, of planning and wishing and hoping, and here we are, finally, to start right with Start Right, which aims to assist with the provision and distribution of care supplies for at-risk mothers and their infants. Now, we all know the cost of maternal health care is challenging to families, and that is why Start Right's mission to assist with donated supplies from the American Friends of Jamaica, who have actually stepped up in supporting the Ministry of Health and Wellness, is so timely. I think that deserves a round of applause. We're going to be doing a lot of clapping this morning. Good practice. Now, another goal for Start Right is to deploy safe, modern, state-of-the-art tools to make maternal health care in Jamaica not only safer and easier, but just better. Now, this is why JAHJAH Foundation has collaborated with Jacobi Medical Center, Bronx, New York, and the American Friends of Jamaica to support the Ministry of Health in adding maternal health care to its new initiative. What that means is there is the Jamaica Handheld Ultrasound Project, and the acronym is JAHJAH. And this project's goal is to equip public hospitals throughout the island with small handheld ultrasound devices providing prenatal diagnosis by sonography. That is the latest cutting edge technology. I want you to know that in ultrasound diagnostics. If you don't know anything about it, you need to be getting excited because a lot of places, a lot of countries don't have this. We have this in Jamaica. So if you're excited, I'm excited. I want to hear you say JAHJAH. I want to hear you say JAHJAH. I want to hear you say startup. Let me hear you say JAHJAH. JAHJAH. I want to hear you say startup. Startup. That's what Start Right and JAHJAH. Start Right and JAHJAH. Start Right and JAHJAH. You got it. See, I purposely did that so you would get it. Dr. Kingston, you know, that was my little flow. I was trying to. All right, I'm working hard this morning. As you can see, we're starting right this morning, right? Because it's Start Right and it's JAHJAH. And we are about to revolutionize healthcare in Jamaica. And this is a big deal. It's all about building a stronger community. That's why we're here. You see, the JAHJAH Foundation and the Jacobi Medical Center, their role in this initiative is really to provide ongoing training, which is very important because it's one thing to have the equipment, but you got to train people how to use the equipment, right? So that's their role. So they're going to be doing ongoing training, consultations, and Dr. Clooney will love this, critical assessment via monthly and annual workshops. And that is with the support of all of our volunteers. And many of them are here today. They deserve a round of applause right now again. Told you that I'll be clapping a lot. Because you know what they do with this training and this ongoing consultation and this critical assessment? They are able, very important, to share their knowledge and their expertise with the recipients of the Butterfly IQ Probes. That's what it's called. Write that name down. Might want to hashtag that too. The Butterfly IQ Probe, and you're going to see it in a minute. Now, the JAHJAH Foundation is really delighted and extremely grateful for all these collaborations. And to all the volunteers who have journeyed from afar, overseas, and even the local volunteers who have come, you are a part of what is a groundbreaking undertaking that will not only save lives, but will help to make quality healthcare more accessible and more efficient in, Dr. Wong, the accident and emergency rooms and in the treatment of maternity care throughout the island of Jamaica. That's a big deal. More claps. Yes. Yes, 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 yes. So now, ladies and gentlemen, it's time. I want you to help me welcome someone who is very near and dear, full disclosure, to my heart because of the work he does. Please help me welcome Dr. Trevor Dixon, the visionary and founder and CEO of JAHJAH Foundation, to give his remarks. You gotta clap a little bit now. You can clap this in. All right.
I'm a little taller, so you have to excuse me. Just a little bit. This is a tough act to follow. She's very enthusiastic. Thank you, Sharon Gordon, and a heartfelt welcome to Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, the Honorable Juliet Cuthbert-Flynn, Minister of State in the Ministry of Health and Wellness, and Member of Parliament, and other distinguished guests. Ladies and gentlemen, thank you for being here. It was the Prince of Reggae, Dennis Brown, who sang, "No man is an island, no man stands alone. Treat each man as your brother, and remember, each man's dream as your own." There is no better example I can use to describe the various collaborations which has made this day possible today. it was 15 years ago, my friend Lyndon Williams took me down the windy road at KPH because I was a doctor from New York and I wanted to give back to my country. And it was 15 years ago that I met Dr. Hugh Wong at the KPH hospital. And he and I started conducting ultrasound workshops for doctors who oftentimes would return to facilities and they didn't have an ultrasound machine. And some of them went back to a facility and the machines were broken or in disrepair. But still, Dr. Wong and I, we continued holding our workshops. And over the years, 15 years, we've trained over 400 physicians in the public hospital. That's it, that deserves a round of applause. And this was made possible through donations from supporters and sponsors from here in the Jamaica diaspora. So I want to big up the Jamaica diaspora at this time. One could almost say it was through divine intervention that we were introduced to Ms. Wendy Hart of American Friends of Jamaica. While we were aware of the great potential of the butterfly IQ probes in ultrasound diagnostic for Jamaica's public hospital, Wendy Hart and her team at AFJ were simultaneously becoming aware and exploring this new technology for the Jamaica's public hospitals. Wendy Hart was concurrently working with the Ministry of Health and Wellness on Start Right, a maternity and newborn care initiative. Working with both the JAHJAH Foundation and the Ministry of Health, the brilliance struck. The Jamaican handheld ultrasound project, called JAHJAH, has now become associated with Start Right, which we're here to launch today. How amazing is that? Round of applause. This is truly divine intervention at work that three great organizations, the JAHJAH Foundation, AFJ, and the Ministry of Health and Wellness are working together for a common cause. Putting aside our egos and getting this project completed in approximately 6 months. A true example of public-private partnership in Jamaica. For Jamaicans. AFJ has stepped up big time by funding devices for phase 1 of the Jamaica Handheld Ultrasound Project, JAHJAH. JAHJAH Foundation and the team at Jacobi Medical Center in the Bronx, New York. Will the team stand up for a second, JAHJAH, Jacobi? The JAHJAH Foundation and the team at the Jacobi Medical Center in the Bronx, New York has mastered their passion and dedication by committing to the ongoing education and training of doctors in ultrasound technology on the use of the butterfly IQ probes with our partners at the University Hospital of the West Indies and the Kingston Public Hospital. We are all committed in making JAHJAH and Start Right projects successful and most importantly, sustainable. We hope to work closely with Jamaica's public hospital to advance diagnostic ultrasound education for clinical practitioners because ultrasound saves lives. These small, compact, handheld technology, just so you see what I'm talking about. This is the technology you need, folks. Hook this up to your devices and you can save lives immediately. But these small, compact, handheld, technologically diverse butterfly IQ probes will allow physicians and clinicians to save Jamaican lives. A round of applause for the butterfly IQ team. Yeah. You know, had it not been for this technology, the butterfly IQ probe technology, we would not be able to put this great technology in the hands of so many Jamaican clinicians. This device is truly a game changer. For example, instead of bringing patients to another department to have an ultrasound being done, this device is 100% portable and can be placed in the doctor's pocket, as I just demonstrated. And you can see here, truly streamlining patient care. While these devices are great, they're only useful with adequate training. Therefore, I salute the volunteers, trainers, and lecturers from the JAHJAH Foundation who have traveled from over 5 states in the USA, Jacobi Medical Center in the Bronx, New York, Dr. Garfield Clooney from NYU in New York City, Dr. Maria Small, from Duke University in North Carolina, and of course our partners here at the University Hospital of the West Indies, led by Dr. Simone French and Dr. Hugh Wong at the Kingston Public Hospital. The JAHJAH Foundation has led this training and education initiative here in Kingston for over 15 years because we know the importance of the accurate and ample ultrasound education in the act of saving lives. If you give a man a fish, he eats today. Teach him how to fish, and he eats for life. The individuals being trained over the next 2 days are our super users, who will be tasked on teaching everyone in their department in the use of these ultrasound IQ probes, thus guaranteeing sustainability. Thanks to the organizers of this workshop, Ms. Karen Shields, which everyone who's involved in her Shields. Ms. Karen Shields, the Jamaican liaison and project manager, who has done a tremendous job of putting this all together, all while having other members, volunteers in the team in the field as we speak right now. And of course, additional thanks to Ms. Khadisha Watkis at the Ministry of Health and Wellness. Remember, Dennis Brown said, remember, we can't live in this world all by ourselves. No, no, no. We cannot make it alone. Just as sure as you try to make it by yourself, you're going to wake up and find yourself you're going to need somebody else. Thanks to all our partners, our volunteers, sponsors, and supporters. You've made a wise and invaluable investment in the JAHJAH Foundation. We are on social media, Instagram, Facebook, Twitter, and we also have a big presence on YouTube at JAHJAH Foundation. Please like, follow, and share. Also, visit our website at jahjahfoundation.org, and don't forget to donate. One love for the JAHJAH Foundation.
You got to back them up. I've already been practicing. Dr. Dixon was quoting Dennis Brown. And for our non-Jamaican friends, go check out who Dennis Brown is as the Crown Prince of Reggae. The essence of the music speaks to the work that we are all involved in here. So kudos to Dr. Dixon again. I'd like to acknowledge the presence of Dr. Sonia Copeland, retired Director of Health Promotion and Protection, current Chair of the Public Compassionate Fund. Hey, there you are, Dr. Copeland. Also clap her up. I also want to recognize Dr. Brian James, President of the Medical Association of Jamaica. Dr. James, how are you? Thanks for being here. At this time, I'd like to invite Wendy Hart, President of the American Friends of Jamaica, to come on up and make a few remarks. So you got to clap up Wendy Hart, because thanks to the American Friends of Jamaica, we have butterfly IQ probes and iPads. So clap.
Thank you. Thank you. I'm really happy to be here today, and thank you so much to Minister Tufton and to Minister Cuthbert Flynn for not only for attending, but really for leading on this initiative. So today for me feels like a very big day. Not just because of the incredible work that will be happening with our volunteer doctors from Jacobi, NYU Langone, led by Dr. Dixon and Dr. Clooney, along with the doctors from 11 hospitals across Jamaica. Because today is the start of something bigger. Today is an example of how ideas can germinate and develop and come together for a bigger initiative. We've started this story before, but I still think it bears some retelling. So I think we said it was in March, in March the 1st. I had a very good friend who was the chief medical officer at Butterfly, and we were talking about how it could really have potential for use in global health and in Jamaica. And one day she called me, I think Trevor was actually in her office, and she said, "Do you know Dr. Trevor Dixon from JAHJAH Foundation?" And I said, you know, I know JAHJAH Foundation, but we've never met. Like, we're working parallel in healthcare, but we've never actually met. And so she set up this call with both of us to see where it could go. And as Dr. Dixon said, they were working on a pilot project for Black River. And we started to talk about how we could make that something bigger. And that was the launch of JAHJAH. And then simultaneously, Karan Chung, our executive director, was working very closely with Minister Cuthbert Flynn and with Dr. Ennis on a maternal health initiative. And then we came together and we said, how can we make this something bigger? Because I think actually in the beginning, these handheld devices didn't even work for OB, right? I think it was stage 2 when it got to IQ+. So we were like, wow, they can now work for OB. This is going to be really incredible. And this is really the place where AFJ likes to do its work the best. When we know we can be involved with a grant of impact and transformation and change. And I really thank all the medical professionals in this space today, both who are training and who are going to be taking this out and, as Dr. Dixon said, become the super users and trainers themselves. Because certainly on the launch of JAHJAH, the team from Jacoby and all of the doctors, Dr. Wong will call you out, but it was a Dr. French, there was a team of 10 or 11 people who met, who talked about whether the handhelds were the right thing for us to use, which manufacturer we should use. It was a long time getting to where we are here today. So thank you so much. And I'd like to thank, you know, partnerships are really what get things done. So to the Ministry of Health and Wellness, JAHJAH Foundation, the doctors, and as we said, always the donors. Because sometimes people look at our foundations and they think, oh, this foundation gave. But really, we don't have any big, we're not like Gates Foundation with $1 billion sitting down and we have money just to decide what to do. No. The only way that we get our work done is that every year donors give us money and every year we give out all of that money and then we start again. So we have a gala in Miami on March 11th, one of our fundraisers, if anyone would like to be there. So some at Bailey Healthcare, Ralph and Ricky Lauren Foundation, the Bluefields Villa Foundation, they were our major donors. But as Dr. Laura Tanner, who's one of our directors, said, we also at our gala raised funds. So there were many donors who gave $100 towards helping us get one of these devices. So today is the start. And as we've mentioned, we hope that we will actually move on to phase 2. Our goal is to have these handheld devices in as many doctors' pockets as possible. One of the things that we will be very actively involved in is monitoring and reporting back on their continued use. Quite honestly, we've been reaching out to many doctors in the US, and one of the things that they're worried about is are they going to stay in the hospital because they are so portable. But you know, we really believe in transformation and care, and we think that what we'll be back for next time is phase 2. Thanks.
Keep the applause going. Thank you so much, Wendy. Thank you. Butterfly IQ probes, revolutionary, and Jamaica now has 24. Okay, calm down. Now we'll have remarks by Adwana Clayton, Director of Training and Education at Butterfly Network Inc. Now you gotta make a whole lot of noise, all right? This is Butterfly Network Inc. Come on up.
She has a lot to follow. Thank you for having me, and good morning, Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, the Honorable Juliet Colbert-Flynn, Minister of State and Member of Parliament in the Ministry of Health and Wellness, and other distinguished guests and ladies and gentlemen. My name is Edwana Clayton. As Sharon mentioned, I'm the Director of Training and Education at Butterfly Network, and I'm also a sonographer. And I'm very pleased to be here today to celebrate the launch of the Start Right Maternal Fetal Health Program and with the JAHJAH project. I'm proud to know that our Butterfly IQ Plus technology will be utilized to improve maternal and accident and emergency care here in the Jamaican community. In both care settings, ultrasound imaging can inform and enable life-changing care decisions. In accident and emergency care, ultrasound can contribute to the optimal patient management by providing timely care, improving diagnostic accuracy, and increasing the safety of procedures. For pregnant women and their unborn infants, access to routine imaging can meaningfully enhance the care, enabling better monitoring and management across the maternal fetal care continuum. While 2/3 of the world does not have access to medical imaging, at Butterfly, we are trying to change this statistic for the better. Guided by our founding mission to democratize healthcare, we are well within our journey to make this possible. We do this by bringing our versatile, affordable, and easy-to-use Butterfly IQ Plus, the world's first single probe for whole body imaging. It truly is revolutionary. Being a sonographer, it was amazing to find out about this technology and be a part of it all. And we're so proud that 24 of our probes will be distributed to the antenatal and accident and emergency departments here in Jamaica. Our work here exemplifies our ongoing commitment to health equity and to forging strong partnerships and collaborations that enable us to make this change. We know that we cannot transform care alone. And with that, I would like to recognize and thank the American Friends of Jamaica for funding this important work. As well as the JAHJAH Foundation, Dr. Trevor Dixon of the Jacobi Medical Center, and Dr. Garfield Clooney of the National Medical Association, who are also instrumental in this program. Thank you. It is the caregiver engagement and education that you all enable, the hands-on training that you execute, that allows our technology to become accessible and usable by providers within these communities. Thank you again for the Ministry of Health and Wellness for your partnership, for supporting this project, and believing in our mission, and helping bring this beyond maternal care for this country. And we are also very proud and confident that our work here will serve as a model for future expansion and additional efforts to improve access to life-saving medical imaging throughout Jamaica. Thank you.
Thank you, Ms. Clayton, for your remarks and for being on the ground to facilitate the training of these devices. Well, now we take a breath. We good?
Yeah.
There's a lot going on. Hashtag Start Right. Hashtag JAHJAH. Remember that. Now it's time to hear from Dr. the Honorable Christopher Tufton, Jamaica's Minister of Health and Wellness, and a champion for healthcare and wellness at the same time. Clap him up. Welcome.
Thank you very much, Madam Chair, and I think that you will be the first patient for these machines. But so far, so good. You're sounding very healthy. All right, so let me begin by recognizing you, Madam Chair. Thank you for the management of the proceedings. My colleague, Minister of Health and Wellness, Minister of State, Juliet Colbert-Flynn. I want to really recognize her particularly because She's the driver of the maternal health program in the ministry. She really should be giving the speech, but she insisted that I do it, so I want to recognize her. Thank you very much, Juliet. Mr. Dr. Trevor Dixon, founder and CEO of JAHJAH Foundation. I came here last evening and he was not as appropriately attired because he was working mode in his shorts and all with all the other members. Many of whom are not here. I should say that they're about what, 40? 45. Indeed, if anybody from the Pegasus is here, we deserve a commission because we have about 100 healthcare workers abroad staying in the hotel. 3 delegations, the JAHJAH Foundation, there's another group, OID, who will be at UWI doing heart surgeries, and there's a Code Care second batch of nurses who are going to be at Bustamante Hospital to do backlog surgery. So the Pegasus is doing very well as a result of and of course tourism also. Thank you very much. So we did have a little chat, and a lot of work has gone into getting us in this formal setting. So I want to recognize Mr. President, CEO, and all the other members, of course, of the JAHJAH Foundation. Of course, Wendy Hart, President of the American Friends, needs no introduction, longtime friend, and of course doing an excellent job with other members of our team. Thank you very much, Wendy. Please pass on our full membership. I see Ms. Laura Tanner here, who is a member of the director, and also Alex Clark, where is she? Oh, there she is in the back there. So thank you very much to the American Friends, and if you can afford to go to that gala event in Florida, please do, because we can take the money, right? Here. But excellent organization and really doing a good job. Thank you very much. To the members of the, well, let me recognize Ms. Clayton, Director Training and Education, Butterfly Network. Thank you very much for being here, and thanks for helping to coordinate the technology. My team who are here, too many to mention, members of the Ministry of Health and Wellness. I see Dr. Ennis and others. I want to recognize all of you and thank you, of course, for the coordination. The CEOs and the SMOs and the members of the hospital community who will benefit. I understand all hospitals will benefit from these devices. I want to just thank you for being here, for supporting, and of course, we have a lot of work to do, and we're now empowered to do even more. What all of this points to, this very long introduction, but necessary run up to the wicket, is that partnerships do really work. Yeah. And with the right coordination, with the willingness, with the attitude towards doing and serving our mandate, we are far more effective as a team rather than as individual silos. And I think this is a manifestation of that. And we all deserve a very big round of applause for doing that. As I said, there are 100 or so healthcare workers in this precinct over the next week doing different things. And I feel proud to be leading a team that I think that over the last number of years have really embraced and reinforced their efforts to collaboration and partnership. I have Mr. Cephas here, who is head of our foundation, which has been enhanced with a larger contingent of workers approved by the Ministry of Finance, a new office setup, new budget, and the intention is really to make the gifting towards public health and health generally a critical part of what we offer normally in our normal course of activities. Because as we can see, and we are part of this, there are many persons, many entities who want to contribute, who want to give, who want to be a part of making a difference. And what we have to do is to make that easier so to do. And I've heard that the baby box that should have been here is still on the to be cleared. I hope it's cleared by now. So there are some conversations that have to take place to ensure that we enhance the efficiency of the process. But I think we're on the right track, and I want to commend those who, despite the obstacles, have continued to move in this direction. So this partnership today, the Start Right, latest maternal and newborn health initiative to come out of this partnership, including, of course, the organizations and the Ministry of Health and Wellness, targeting, of course, vulnerable mothers in the first instance with care supplies, while also delivering a very important aspect of diagnostics for maternal health. The intervention is indicative, hopefully, of the priority that all of us here, but certainly the ministry, is placing on maternal health benefits and the importance of that to human development, to economic development, to social development, to society. We don't talk about it often enough. More often than not, we identify the challenges and fail to recognize some of the root causes. It really starts from the womb, and it starts from the community. It starts from how we take care of ourselves, and by extension, those we are responsible for. And oftentimes, I think if we don't correct that, then some of the other issues that we have in our society will continue. So we're focusing on pregnancy with the donation of and the provision of training on the use of these portable ultrasound machines, and after pregnancy with the donation of needed supplies to aid in the care of both mother and child, which is very important. 24 machines, I'm told, that are going to be donated to 10 hospitals initially island-wide. And I say initially because I know after the Florida event, another 24 machines. The other, I'm talking it into being, right? So the obstetric units and in our accident and emergency, so we're going to use in the two critical areas. The hospitals that will benefit, I understand, are Victoria Jubilee, Kingston Public, Cornwall, Black River, the University Hospital of the West Indies, Sablamar, St. Anne's, Maypen, Princess Margaret, Mandeville Regional, and Spanish Town. Very, very busy entities, institutions, so it will come in extremely handy. The value of the donation to enhance is really enhancing the care that we spoke about, the diagnostic care, and to safeguard the best health outcomes, which is a critical part of our mandate. I have already done so, but I'll do so again. I want to recognize the American Friends who have financed the ultrasound devices to the tune of some US $25,000. And even though we don't have on display the snuggle nest as part of the overall program of outreach for maternal care, I want to also recognize American Friends who have initially contributed, I believe, 100 of those, with another 2,000 or so to come. I don't know if you have the picture on the screen. What is good about this, and this is, I'm really happy for this, because 5 years ago I went to Europe and saw what is referred to commonly as a baby box, which is used a lot in the Scandinavian countries, also in the UK, which essentially incentivizes mothers to attend clinics with a gift, if you will, not just the actual box, crib, for want of a better word, but also supplies that will help in terms of the maternal care for the child. And so every time the parent, the mother, attends clinic, they would add something to the box. I thought it was an amazing idea, because in Jamaica, I don't know if you know, some do, many of the doctors, if you work at Victoria Jubilee Hospital, the largest maternal institution in the Caribbean, you recognize that some mothers don't turn up until the baby is literally ready to be delivered. And you don't know, right, Dr. James, if the baby upside down, crossway. And when I discovered that as minister, I recognized how much of an expert our doctors were. Because they literally have to do the diagnosis on the fly. And I am not exaggerating. And both the diagnostic equipment, the handheld, will certainly assist that, but also this snuggle nest will also be critical. The intention is to use it, starting with vulnerable mothers as a pilot, and hopefully incentivize them to come to the clinic for prenatal care, and then hopefully allow the health system, doctors and nurses, to better understand their particular circumstances and give the babies and mothers the best possible outcome. So we are going to be piloting this, and if it works, we are going to be mainstreaming it across the board. So really excited about it. I'm sorry we don't have of course, the JAHJAH Foundation has been ongoing 15 years, is it? You don't look much like, I mean, you're a founder, right? You started very young, okay. But, you know, it is always more rewarding to give than to receive. So I'm sure that has contributed to your keeping young. But the JAHJAH Foundation has been a critical part of the program. My understanding is that you have several executions this week. This is just one, which is why some of your members are not here. And I want to just especially recognize and celebrate you. The issue of maternal care, and I'm going to sit now, but for the purposes of justification as to why this is important, is very critical. I mean, the ultimate end, of course, is to have healthy babies. And mummies, right, of course. To ensure that, you know, they have the best outcome, that they can develop and they can mature, like we all have, and find their rightful place in society as valuable contributors to life and to happiness and so on. That's really the objective. Now we have some targets that we focus on. There are some global targets out there that are important to appreciate. In Jamaica, we are trying to reduce our maternal mortality ratio to 70 per 100,000 live births by the year 2030. We're some ways from that. I am told, are 110 per 100,000. In 2016, we had gone down to 93.5 per 100,000 in 2018, and the preliminary data in 2019, 2020, those terrible COVID years suggest that it has inched back up. I don't have this specific number. But that's something that we have to keep working towards. So it's a target that we have not yet achieved, but I think we have it in us to make that achievement possible. And so the efforts today by this group of volunteers, of contributors, is to bring that target down in the interest of our mothers and our babies, and by extension in the interest of our society. I want to thank you again for participating. Thank you very much for all the efforts that you have made. And I want to just encourage our doctors, hospitals, nurses, as they continue to work hard for the benefit of the patients that they serve. Thank you.
And it's time for Dr. Garfield Clooney to come up. Clap him up.
Good morning, everyone. Good morning. Dr. the Honorable Christopher Tupton, Minister of Health and Wellness. The Honorable Juliet Upford Flynn, Minister of State in the Ministry of Health and Wellness and Member of Parliament. Other distinguished guests, ladies and gentlemen, good morning. It is an honor to be with you this morning on this momentous occasion. I would like to congratulate the Minister of Health and Wellness on the launch of Start Right in partnership with the American Friends of Jamaica, and also congratulate the JAHJAH Foundation on their 15th annual Emergency and Critical Care Point of Care Ultrasound Workshop, which this year will include a point-of-care ultrasound in obstetrics using the butterfly ultrasound device. It is programs like these that will revolutionize the care that Jamaicans receive and help ensure that all Jamaicans attain the highest level of health possible. I'm going to pause just for a moment for a brief video that is going to talk about the handheld device. But essentially, this is stationed in Nairobi, Kenya, and they are fortunate, like we are in Jamaica, to have the butterfly machine to use with their patients that come to A&E as well as the obstetric unit. And the real importance of this, as the JAHJAH Foundation, Dr. Dixon said, that it really revolutionizes what we do with healthcare because, you know, I'm a physician that practices in New York City, and I know that sometimes when I have to go to the emergency room or I have to go to see a patient, sometimes I can't find an ultrasound machine. Sometimes the machine is not charged. You know, we can't provide the optimal care that we should to these patients to achieve the best outcome. And so with this actual handheld device, you know, really it's a pocket device. You run around with it in your pocket, and the technology and the resolution is such that if a woman comes in with bleeding, with loss of fluid, or any complaints, you can actually do a full evaluation of the fetus, as well as a full evaluation of the placenta, evaluation of the adnexa to look and see if she may have an ectopic pregnancy, if it's an early pregnancy, as well as diagnose why she's bleeding. As we know, worldwide, maternal hemorrhage is one of the leading killers of moms, and it's very important that we're able to diagnose these problems early. And so we are very grateful to have the Butterfly IQ here on land in Jamaica, and we look forward to them being available at all hospitals within the country. And as you can see, it's very simple to use. You either plug it into your phone, or you can plug it into an iPad. We're very fortunate again through the American Friends of Jamaica that we actually have iPads that we're going to be using, and it really makes the technology great. And patients themselves, one of the greatest things about it too, what I find is patients sometimes don't keep track of their care or know their due date or know where they are in their pregnancy, and actually the Butterfly machine can actually, because everyone has a cell phone, can actually transmit a report of what you've done to the patient's telephone, and so they will have a record of what's been done, so they can bring back to their community. It's really amazing too. It's really amazing. And so I'm just very grateful that I was invited to participate in this in this endeavor. You know, I'm a son of Jamaica. I'm from St. Anne's Bay, and you know, nothing gives me more pleasure actually than coming to Jamaica to give back. And so thank you again for this opportunity, and look forward to helping to improve the lives of women and all in Jamaica.
Now, ladies and gentlemen, help me welcome the Honorable Juliet Cuthbert Flynn, State Minister in the Ministry of Health. You know, this former Olympian has a passion for maternal health care. You all know that, right? And she really carries this as a baton in her portfolio. Ladies and gentlemen, it's time for the big reveal. So we invite Dr. Tufton to come up as well, and Dr. Dixon and Ms. Hart, please come forward.
And of course, I am very excited for this unveiling of the Start Right program. This initiative is very dear to my heart, and of course in the Ministry of Health and Wellness. So very excited that we're going to unveil this from the Ministry of Health and Wellness. And we're going to go 1, 2, 3. All right. Yeah. So much, and I have to thank the Honorable Dr. Christopher Tufton, my minister in the Ministry of Health and Wellness, and I have to say, you know, he actually pushed this on me. He said, Juliet, I'm going to give you a project that you need to finish. In 2020, he actually laid this in my hands and said I was going to do this baby box project. and I want you to take this over. Of course, the COVID-19 pandemic came. Dr. Ennis and I were trying to work on it, didn't get a chance to really finish it, and as soon as this year started, we said, let's get back on track, and here we are. Dr. Trevor Dixon, founder and CEO of JAHJAH Foundation, Ms. Wendy Hart, of course, so critical in this, president of the AFJ, Ms. Karan Chung, she's not here, but let me tell you something. A few months ago, again, my minister said, look, I'm going to put you in the hands of Ms. Chung, and she just took this off with her team, and I have to congratulate her and her entire team for really making this happen with us. Ms. Adwana Clayton, Director of Training and Education, Butterfly Global Health, Dr. Garfield Clooney in Maternal Fetal Medicine, and of course, Dr. Melody Ennis, who was the lead in this. We couldn't see her hands to really take over. All the senior medical officers, all the directors in the Ministry of Health and Wellness, and of course our distinguished guests and members of the media. Again, I am just overwhelmed with joy this morning that this project has really come to light. Ms. Watkins, we know that even during her vacation, we were hammering her to make sure that we were here today with the Start Right program, that we got it off the ground. And so I'm really delighted to unveil and introduce the latest initiative in our maternal health program. This is needed, this is indeed a really monumental day for Jamaica's public health, made through possible with a partnership that we're forged. Maternal care continues, as we know, to be very important in the promotion of good health and well-being. Essential to this is for all women to have access to respectfully and of course high quality maternity care. And so allow me to set a context before we get into some of the more tangible aspects of the morning's launch ceremony. Top of the global health agenda is ending preventable maternal deaths. Minister Tufton spoke about it and where we are. And so we're really, especially after COVID-19, we saw how many mothers really passed away from comorbidity of the COVID-19 pandemic. And so we really need to get her numbers down. And so the World Health Organization knows that maternal mortality greatly affects women in low resource setting, with maternal mortality pronounced among women living in rural income surroundings, and we have lots of rural parts in Jamaica. Moreover, it is noted that adolescents are among those who are mostly impacted as they face high risk of complications because of pregnancy. It is therefore essential that all women, especially those most vulnerable, have access to high quality care in pregnancy, during and after childbirth. And as the Ministry of Health and Wellness, we continue to give a keen focus to addressing inequalities in access to maternal and newborn health care services, and identifying and mitigating all causes of maternal mortality, morbidity-related disabilities. Our maternal health program prioritizes care across the continuum from pre-pregnancy, birth, postnatal, and early childhood through to the first 5 years. Our dedicated efforts include, of course, enhancing universal health coverage for comprehensive reproductive, maternal, and newborn care in order to deliver better outcomes for every pregnant woman and newborn. We note that it is critical that women be able to access emergency obstetrics care, especially when faced with high-risk pregnancies, and it is especially imperative that skilled health professionals, all you in this room, attend to all births. These are among the ingredients of a robust maternal health program. And so the Start Right, it is on this basis that I'm honored to introduce the Start Right, a maternal and newborn care initiative that aims to foster happy mothers, healthier babies, and of course, what do we get? We get a stronger community, and that is what we're trying to build. Because again, with all the things that's happening, it did not just start just like that. It started from here, and so we have to make sure that we are doing all the right things. Start Right will serve vulnerable mothers as they access care through the public health system, Overall, this initiative is focused on improving pregnancy outcomes for high-risk, low-income pregnant women. Start Right brings before us a tremendous opportunity to improve our maternal health offerings, but even in a broader sense, the family. Ensuring a mother's well-being before, during, and after pregnancy will enable her for better care for herself and her newborn. And so we're giving her the tools to actually do that in the first at least 6 months. This need is quite evident among those who are neither financially, emotionally, nor socially equipped to handle demands brought about during maternity. Consider the mother with limited economic opportunities or the teen mother, and we know there are lots of them, teen mother who is yet to understand in full the role that lies ahead. These mothers need the support in order to start right. We know all too well that many such mothers often come forward for care late in pregnancy. And so this delay in care, regrettably, can affect mothers and babies' health throughout and after pregnancy. This is why we conceive a community health perspective for this program in order to receive vulnerable mothers into care with the help of our community health aides. And we saw how important those community health aides was during the COVID-19 pandemic. We were really, I thought, the lead in that, when you look at what was happening throughout the world. Provision of prenatal support as well as timely management and treatment can make the difference between life and death for mothers as well as their babies. In addition, the Start Right will provide a range of care supplies for vulnerable mothers and their newborns, and also deliver improved diagnostic service across public health facilities through modern state-of-the-art ultrasound technology. The specialized training for healthcare and specialized training for healthcare providers. The Butterfly handheld ultrasound monitor will receive into the obstetrics, as we heard, units of 8 public health hospitals. The portable device supported by iPad technology will enable early and rapid diagnostic tests, as we've heard before. And so this is really cutting edge for us, as we've seen on the monitor earlier. On the rollout, we'll have 100 of these given to our adolescent mothers and also our vulnerable mothers, and we'll also receive the Snuggless. Again, unfortunately, it's not here, but those will be on island, I believe, soon. This is a portable infant lounger bed for the mothers, as well as essential items, including diapers and skincare and all the things that you see to my right. The program, of course, will later target some over 2,000 mothers, and we hope to actually have that launch sometime in March. And so this morning, again, as I said, this proud partnership today is a representative of the solid association between partnership and public health. This proud collaboration between the Ministry of Health and Wellness and the American Friends of Jamaica, JAHJAH Foundation, will reset the lives of many mothers and their newborns, giving them the right start. I want to commend my deepest thanks to both entities and their leadership, and look forward to greater gains that will come from work over the years. We in the public health continues to recognize the vulnerability of pregnant women and their newborns. Our focus in this area is especially heightened as we seek to strengthen the capacity and resource to optimize accessible, equitable, and high-quality care across childbirth continuum. The pleasure is now mine, as I said, to usher into this program with our project, and of course we have already unveiled this, and I want to just thank everyone. Again, I want to express my gratitude to Karan Chong of the AFJ, and of course for the strong partnership also to you from the JAHJAH Foundation and everyone who actually helped this program for us to be here this morning for this launch. Thank you so much.
What a program it's been. Lots of information, lot to take in, lot to be proud of. So on behalf of the JAHJAH Foundation, the Ministry of Health and Wellness, American Friends of Jamaica, we thank everyone for joining us this morning for the launch of Start Right. Can we just get that again? Start right. Telling you, we're on the right start. I like it. Now, Dr. Melody Ennis, thank you so much. Karen Chung isn't here, but you've heard her name mentioned because she's so critical to all that is happening here this morning. Nurse Dalian Hemmings, Miss Kadisha Watkins, Mrs. Karen Shields, Health for Life and Wellness Foundation, Bailey's Medical Supplies, Dennis Shipping, all the physicians who came on board to support this initiative, thank you. Clap them up, please. A special thank you to Dr. Hugh Wong, Dr. Adwana Clayton from Butterfly Network, Inc., the volunteer presenters from Jacobi Medical Center for leading our workshop. Critical work, we thank you so much. Dr. Cleon Kelly, the Jamaica Pegasus for hosting us, all of our media colleagues, and just all the officials who have joined us this morning. Thank you, thank you, thank you.
Dr. Thea Nicole Davis. I am a consultant obstetrician and gynecologist and maternal fetal medicine specialist at Mandeville Regional Hospital in the Southern Regional Health, with the Southern Regional Health Authority. Today we were able to receive 2 handheld butterfly ultrasound machines, which will go a long way on our obstetric ward. As I was telling my bosses earlier today, that prior to COVID, right before COVID, our ultrasound machine went down. And of course, COVID has been a priority worldwide, and of course at Mandeville Regional. And now that things are getting right back, to normal, we've been really struggling to manage our obstetric patients because of the lack of an ultrasound machine. So this is an amazing gift. I came here this morning not knowing exactly what to expect, and to know that I'm actually leaving here today with 2 handheld ultrasound machines is amazing, and we are going to get to work with these machines tomorrow. I'd just like to say thank you to American Friends of Jamaica for donating our ultrasound machines today, and for the JAHJAH Foundation for the ongoing training for use of this amazing machine that we will be getting to use as early as tomorrow at Mandeville Regional Hospital.
Hi, I'm Dr. Kimberly Nugent from the Department of Obstetrics and Gynecology from the St. Anne's Bay Regional Hospital.
I am Dr. Wilbert McIntosh from St. Anne's Bay Hospital, Department of Obstetrics and Gynecology.
I think it was an excellent presentation. I think it will be beneficial at our institution, and we hope to implement it as soon as possible.
Yes, it was very informative. I am glad that there is, we can compare when we look at this new technology that's available and the existing, right? They are basically neck and neck, and I know that improvements will be made. So this would be innovation for us, and I'm glad to be a part of it. It was very informative and instructive. Yeah, and we hope to implement it as soon as possible.
Our sincere gratitude to the American Friends of Jamaica for the machine that was given to our institution.
All right, thank you JAHJAH Foundation, right, for giving us this training in the using the butterfly ultrasound machine.
Hi, I'm Judith Neathley Roberts. I'm a doctor in OB/GYN at Cornwall Regional Hospital.
Dr. Alicia Slowly, also a doctor at Cornwall Regional Hospital in the OB/GYN department.
Well, the course was a refresher course for us both, but the butterfly probe is a new entity for us. And the fact that it's portable means we can access it in the accident and emergency area and on the labor ward, which will help us really in better assessment of our patients and in making quick decisions whether we need surgery or admission or center.
Oh, it was very informative, very well organized, very well put together. Really just repeating what Dr. Anita has said before, that these devices will really help us in our management of patients moving forward. So it was very good, very good.
We got 2 machines today and we're most grateful, and we'd like to extend our greatest appreciation to the American Friends of Jamaica. They were very insightful in providing us with a tool that will help us to decrease our maternal mortality and to better attend to our patients here at Cornwall Regional and in Jamaica and the whole. We're very grateful. Thank you, FJ.
Thank you to the JAHJAH Foundation for providing the training for the use of these devices today. We will certainly use it to our benefits.
I'm Dr. Kay Palmer-Cole from the Victoria Jubilee Hospital. I'm an obstetrician and gynecologist.
I am Dr. Cleon Kelly, maternal fetal medicine specialist from Victoria Jubilee Hospital.
I'm Dr. Yor Alfred from the Kingston and St. Andrew Health Department and Victoria Jubilee Hospital.
Training was excellent. We got a lot of information. We have found that the ultrasound machines are easy to use and definitely will be of benefit to us in our hospital.
Yeah, I mean the training was excellent. We had cutting edge technology working with, simple devices that were able to move around and really, help our patients and help us to better treat and help our patients.
I found it to be very exciting. It's nice to have live training, and it's easy to use, and it's something that I can see myself using over and over, that to help our patients.
I'd love to thank the American Friends of Jamaica for giving us the machines. Really appreciate it.
Thanks to JAHJAH Foundation for investing time in training us that will be able to effectively use the machine to help our patients.
Hi, I'm Dr. Trudian Batchelor. I'm consultant OBGYN Spanish Town Hospital. Well, this was an excellent training, very hands-on, which we appreciated, a very intuitive device, so we're happy for the training and we're sure that it will help our department a lot. So thank you to the American Friends of Jamaica and to the JAHJAH Foundation for the training that we had here today.
My name is Adwana Clayton. I'm the Director of Education and Training at Butterfly Network. Point-of-care ultrasound improves patient care, just point blank. Having access to medical imaging is a passion of ours here at Butterfly. Since 2/3 of the world does not have access to medical imaging, Butterfly is changing that statistic for the better. Ultimately, decisions can be made faster, monitoring can happen, and just overall better patient care. So with the Butterfly IQ Plus, it's actually ultrasound on chip technology, which emulates multiple transducers all compacted into one. So you just take this one transducer and you can plug that into any device, whether it be an iPad or an Android device, to transform that into an ultrasound system. And you can get imaging right away. As soon as you plug in the device to your iPad or your Android tablet, it launches the program and you can immediately begin scanning to get your answer faster. Thank you so much. It has been an honor to be a part of this project to implement ultrasound, point-of-care ultrasound throughout Jamaica.
I'm Dr. Maria Small, maternal fetal medicine provider at Duke University Medical Center. That's in North Carolina, in the southern United States. So I have been helping do some training on use of ultrasound for prenatal diagnosis and for diagnosing of common obstetric complications. And I've also been learning how to use and teach the use of the handheld ultrasound device, the Butterfly. I have thoroughly enjoyed my experience. The participants have been so attentive, so grateful, and everyone is very committed to reducing maternal mortality, morbidity, and infant mortality. I'm very inspired. Well, as I mentioned, my family is from Jamaica. I don't know the island as well. I am from the diaspora, so that's very important. And it's also important because it shows that people in the U.S., those of us in the U.S., are very committed to working with the energetic and enthusiastic folks here in Jamaica to improve maternal health, child health, the health of Jamaicans overall. I just find it very inspiring and overwhelming. I'm very grateful that I was able to come. Thank you.
My name is Garfield Clooney. I'm a physician from New York City. I practice maternal fetal medicine, and I am a son of Jamaica from St. Anne's Bay, born at St. Anne's Bay Hospital. I work at NYU Langone in Manhattan at Tisch Hospital and I'm on faculty in the Department of OBGYN. Well, I am friends with Dr. Dixon, who is the founder and CEO of JAHJAH Foundation. And one day he talked to me about doing a ultrasound conference here in Jamaica and said they would like to add an OB component to it. And so naturally, any opportunity I have to give back to Jamaica, I try to do so. And so I'm here in the role of doing the point of care ultrasound program in obstetrics. I think it's really a fantastic idea. Whoever came up with the idea, it was a fantastic idea to have those here on the island, because these allow for what we call point of care testing for pregnant women, and it also allows for early and accurate diagnoses so that they can be treated appropriately. As we know, maternal mortality is increasing around the world, and this is one of the ways we can try to help combat that. And so I'm really pleased and very delighted to help and be part of this production. I think the technology is great. The resolution on the machines is excellent. They're very portable. They're easy to use. So yeah, it's a great addition to the healthcare system. Well, I left Jamaica when I was about 4 years old, and my parents have always made sure that we, my brother, sister, and myself, have a connection to Jamaica. And so I always feel like this is my home. And so I come here many times a year, and I use any excuse to come here, and this was a great excuse to come to participate and lead the point of care ultrasound obstetric course. Thank you very much. Thank you.